Um, so let me just go back. Look, I want to discuss the statistic that a CEO of an insurance company came out with, saying that there's a 40% spike in deaths, not COVID deaths, but deaths from ages 16 to 64, which means that the working class person in the United States, we saw a large increase in deaths, all deaths. So that's everybody included. This is not, again, not COVID. And this is also coming from an insurance company. And there's a good point to make here. If you ever want to get the most truthful version of the story, then get it from the people whose profits derive from the accuracy of statistics. There's no better place to get information on statistics revolving health related issues and deaths than from an insurance company. An insurance company's profits are based primarily on being right when it comes to valuing someone's life. And when it comes to life insurance, it's even more so because a health insurance company can try and dance their way around certain, oh yeah, you got hurt, but you got hurt doing something stupid, or this doctor's out of network. There's a lot of technical stuff that can go into the health insurance part, but when it comes to life insurance, there's no technicalities unless the person committed murder or committed suicide. Like, there's a few things that they can maybe catch you on, but if they agree to insure you for life insurance, then more times than not, they're paying out that money, which means that it takes them, it takes a great deal of attention to detail, and it takes a lot of math to perfect the amount of premium that they're going to receive from the policy. What's up, Jester? Hey, I'm glad Jester came in early to the show. So, and Eric, if you could you give me a sound check on Facebook too, if you're able to? If not, that's fine. But 40%.
You're sounding good over on Facebook so far.
Awesome. But 40%, I want you to think about this. And I've been trying to look it up. But the guy said that if there's a 10% increase, and this company has been around since the 1870s. He's the CEO of OneAmerica out of Indianapolis. Or not Indianapolis, Indiana. I don't know what city. But he said if there was a event that caused a 10% increase in total deaths within that age range, then that's like a once-in-a-lifetime event. Apparently, we are up 40%. It almost seems unreal. I'm going to do more research. Again, this is a topic that was brought to my attention. Apparently, actually, the articles I'm reading, and John, I don't know if you noticed this, but I'm seeing articles all the way back to January 7th on this. So, and I have a comment here that says, my bank called asking if I wanted accidental death insurance, and I asked, 1, can the policy go up? Which is yes. 2, do I get the money if I die in a car accident that was my fault? Is it covered? No. And then 3, do I get COVID? Does it cover it? No. Heart attack? No. So an accidental death policy would not cover any kind of health issue like that. It's an accident. Now, the car accident one, that's a shocking one. I guess they could look back and deem if it's your fault, if it's your fault, then and you're dead, and they probably can't go back and say, well, what was his intentions with the car accident? Some people may have committed suicide that way, or I guess there's a few factors. But that is a good question to ask, and that's questions you should ask your insurance company, by the way. Now, if you did like a fully underwritten policy, Friday County guy, then they will actually pay out for all that stuff. There's only very few limitations with a lot of that, and it may revolve around like if you committed suicide in the first 6 months, then you don't get the payout. There's like little things like that. He says, but every accident could be considered your fault. Struck by lightning. Why were you outside? That's a good point. They're the accidental, when you start getting those specialty policies in with life insurance, every company's different. And I've seen some companies that ask a lot of questions up front, and the underwriting is a little bit tougher, but they don't discriminate on what they pay out for at all. But usually how it works is the life insurance policies that aren't as they're not as invasive on the underwriting and on the front end, you usually have more issues getting paid out on the back end. And that's something to always remember. Look, I'm not here selling life insurance, but that is something to always remember. If a company is being strict up front for the underwriting, it usually ends up being a better policy when you do get it. There's usually a reason why it's stricter up front. And, you know, they're just doing their due diligence. They are accounting for risk. The one thing people don't understand is, he said, can I get a insurance policy as good as Costco's return policy? It all depends. Insurance is something that there's so many different insurance products out there. Now we're going off topic, but there's so many different insurance products out there in regards to life insurance and stuff, and they're used for a lot of different reasons. There's no really one size fits all. Now you have like the Dave Ramsey model, right, where it's like buy term, invest or rest. But everyone's situation is different. Everyone's health is different. Here's the thing. Insurance companies, in as far as I can think of at the moment, are the only companies that can openly get away with discrimination. Think about it. You're a man. Okay, now your premium's more than a woman. You're fat. Okay, your premium's more than someone who's in shape. You go skydiving, or you are a police officer, okay, your premium's more expensive than someone who doesn't, right? It's all based on risk. And John says, so if this is accurate, across the board, people are dying at greatly increased percentages since last year. What has happened that is different? That's what I'm curious about. So the articles I've read, though, John, have said that the increase has taken place after 2019, pre-pandemic levels. So I think they're accounting 2020 and 2021 into this. But I've read another article that said they're actually only taking into consideration after the vaccine was available. And they made it seem like, you know, it was the vaccine that had caused this. I don't think it's the vaccine, and I don't think it's COVID. It's just, it's a tough, I think a lot of it may come down to drugs with fentanyl and depression and suicide. It's going to be something due to the pandemic, but it's not going to be a direct result of COVID. It's going to be something with, they were forcing people to sit in their house for months on end. Or people were losing their jobs and they were depressed. People got out of shape, maybe. It could also be maybe surgeries were turned down. Remember, they were turning surgeries away, like heart surgeries and cancer patients stuff at the beginning of the pandemic because of COVID. How many surgeries that were maybe not supposed to be major surgeries, but ended up being a bigger deal than what, like, let's say you needed a biopsy done. And they postponed it. And that biopsy, it turned out to be cancerous, but you didn't get it done. You didn't know. There's so many different factors that could play into this. But I do know if an insurance company is reporting this number, I would listen to it. An insurance company has nothing to lose with this. I mean, the only reason I could see an insurance company coming out and publicly stating a number like this is because they're paying out so much money. They're worried that they're not going to be able to cover it all, which is a whole other issue. And that's their fault because they shouldn't be insuring anyone for amounts that they can't cover. But excuse me. It's interesting to say the least. It really is interesting because, and if someone listen, Eric or someone, if you could go look up the number of the total amount of deaths last year in the United States and find that for me, that'd be good because that give us an eye opener to what 40% actually looks like. Over on Castbox, he says, I know this guy that had his business had no power. He called the insurance company and they don't cover floods. The power plant company had a flood, but not his business. Oh. So, yeah, look, I haven't worked in like the property and casualty business. I have a life and health license when it comes to insurance. I work in Medicare. I've sold. Here's everything I've done and where kind of my experiences lie. Very, very knowledgeable in life insurance. I've done a lot of life insurance. I have done annuities. I've done health insurance, but not planned health insurance. I've done stuff like disability, accidental death actually goes into the health category, cancer, stroke, heart attack, and Medicare supplements and Medicare Advantage plans. That is where my knowledge lies when it comes to insurance. I don't do car insurance or anything like that. Anything I do is protecting assets. But there is, I know, certain things that when it comes to like property and casualty and those insurance companies and not covering, not paying benefits out, they can be a pain in the ass. Life insurance is very easy to deal with for the most part, but when you start getting the other stuff, it's very not only complicated but frustrating too. Because I've been on the phone with car insurance companies before, just screaming at them because of something they didn't do that wasn't even my fault. And so Jester says 3.4 million deaths according to voandnews.com. Whatever. I'm sure that's the number. So 3.4 million deaths last year. So what they're saying basically is, so some of those are probably, a lot of those are probably over the age of 64. But let's just say half of those were between 16 and 64. I would imagine that 50% were older age people. And I could be wrong. Let's say half of that. So that'd be 1.2 million people. And a 40% increase would be 400,000, 300,000 people. That's almost doubling. Like that's 1.5 times pretty much more than what it was a year prior. Like, that is freaky. That is freaky. Again, I'm not speculating on if it's the vaccine. There's so many different reasons on why there could be such a drastic increase. But, or Jester or someone, can you go and see how many deaths occurred in the United States in 1944? They'll probably come up with the military number, but 1944 total deaths in the United States. I'd like to see what that comparison is, and I would like to go back and see what the difference is. So I guarantee you there was not a. So you said 1.4 million deaths in 1944, and that's in World War II. What was it in 1939? Can you get me that number? So 1.4. So 1.4 million in 1944. See what it was in 1949, pre-World War II in the United States. And that'd be a good comparison to see the
39.
difference. 39. What was it?
1949. That would have been post World War II.
No, 39 is what I want.
39 was the year World War II started.
Yeah, I want 39 because we weren't in the war yet. Uh, and so Fry says, is murder part of accidental death? I understand the heart attacks could not be covered because you didn't watch what you ate, but if you were murdered, that would definitely be covered in accidental death. Yes, I believe so. But there were less people died in the United States in 1944 than in 1939, pre-World War II. So think about that. Now, 1944 includes Battle of the Bulge. It includes D-Day. That includes, I think Iwo Jima was still 1944. If it's not 1944, then it's 1945. But yeah, and John, there's a bigger population now, but it'd still be relative. What I'm looking at is the percentage increase. I'm looking at the difference. So there's a war event going on. Like we are purposely sending soldiers into some of the largest invasions in the history of the world. And yeah, so Friday kind of guy on Castbox asked, do they count deaths in America if they didn't die in America? I think that's American citizens, though, they're counting. So I think the death toll would still be a part of that number. I don't think it matters where they died. So there was a decline in 39 to 44. There was less people that died. Why do you say that number would be irrelevant, though, Jester? However, and guys, feel free to call in. You're not just typing it out. But a 40% increase. 40% increase in deaths. And Jester, he's asking about the overseas deaths from World War II, which would have been a substantial amount. That's what he was asking. Imagine they do. So less people died in 1944 in the height of World War II than they did in 1939 pre-World War II. But in the United States right now, we have more people dying. 40% more people died now than they did in 2019.
Like,
What's up, John?
I mean, really, irregardless, I'm sorry, I got a lot of echo. If I'm
All right.
not working, let me know. You've got the CEO of an insurance agency saying that it's across the board, not just Indiana, that they're seeing this everywhere, this 40% increase. And a 10% increase would be considered, I think I read, he said it would be catastrophic.
Yeah, that's what I saw too.
So 40% is, way more. So, obviously, yeah, I agree with you that you get the suicides, you've got, and I thought that was a really good point that you brought up about the hospitalization, people missing cancers and biopsies, and they're dying, home because they can't even get to have their regular surgical procedures. That probably was elevated, but still 40%. I mean, it just seems astronomical.
It does.
Difference.
Jester goes, McDonald's was invented in 1955, just food for thought. but it wouldn't take until 2019 to see those results. We've been seeing that. We've been living with that for a while, Jester. So that's already plagued our death toll. Now, I have one of the articles pulled up here. And here it says there's been an estimated 942,000 excess deaths in the United States since February of 2020. And now this article was written January 7th of this year. It says that Hispanic, Black, and Native American and Alaskan Native populations have disproportionately been affected with high death rates, research shows. I'll have to go and look at that research. But it says previous crises pale in comparison to the pandemic. A 1 in 200 year catastrophe would be a 10% increase over pre-pandemic levels. So 40% is just unheard of. Many of the deaths aren't counted in the official COVID tally, he said, because they happen months after COVID infections. The deaths that are being reported as COVID deaths greatly understate the actual death losses among working age people from the pandemic. It may not all be COVID on their death certificates, but deaths are up in just huge, huge numbers. In addition to deaths from COVID-19, drug overdoses, already one of the leading causes of death for working age adults, and homicides have also risen during the pandemic. It says that insurance are also seeing a rise in disability claims, at first for short-term disability and now for long-term disability, because of both COVID and delayed care for other illnesses. So that goes into what I was saying earlier, John. It says, where was I at?
The other thing is that they're talking about that most of the deaths from COVID, I believe the statistic is like 83 or higher percentage are in the elderly. You're talking over 64.
Say that again. Sorry, I was typing something.
That most of the COVID deaths, like 83% of them, are in the elderly who have COVID and died with it, not, the 16 to 64-year-olds.
What I'm thinking too is it's a weird, and you know what, how this is going to be spun though. There's going to be a spin to this. There's going to be a spin to this. They're going to say that these deaths were caused, that it was the frontline workers that were dying, and they're going to say that it's because they weren't vaccinated. But the problem is that the majority of what they're calculating took place after they had the vaccine available. And T-Fish on Castbox says that's how the COVID deaths were inflated. So what we're looking at, though, wouldn't matter how the deaths are reported, though. Right? So we're looking at the total deaths, T-Fish. As far as the total number doesn't matter. But you're right, they do inflate the amount of COVID deaths. So what that would do is actually provide a narrative that is not necessarily true as far as how the people died. That was referring to Friday's comment. Oh, sorry. Well, I just looked over and saw that. But it still makes a good point because there's going to be a spin to this. Like I said, they're going to pin it on the frontline workers are dying because they weren't vaccinated. And that unvaccinated people are the ones that are responsible for the large increase in deaths. Now, to me, that's pretty fucking stupid. And that's pretty fucking stupid because what the number I saw in December, 72% of the U.S. population was vaccinated. So how the hell do we have more people dying if it's a pandemic of the unvaccinated? How do you have a consistently increasing vaccinated population and you have more people dying? So the argument of vaccine works, vaccine doesn't work, whatever, we can argue and go back and forth about that all day, but there is a direct correlation that, as opposed to politicians lying and the numbers in COVID. Because as the numbers in COVID rise, the more politicians lie. It's easy to see. Joe Biden's COVID plan has not worked. Now, I say that, but I don't mean as though anyone could have done better. I don't know what could have been done better. I'm just telling you that the guy who ran with a plan that was going to work and shut down the virus is accelerating it. Doing the opposite. Amid all of his vaccine mandates, amid all of his comments criticizing people who didn't want to take a vaccine, trying to take freedoms away, it's getting
Mike,
out of hand.
speak again to the what you were saying about the insurance agencies. I mean, and if anyone's going to be truthful, it's going to be them. I mean, if you think about the statistics, I don't know how, car insurance works as opposed to life insurance, but they know exactly the statistics of any age, and how many accidents they have and every little detail about everything. So they're not the ones that are fudging the numbers.
Insurance companies. Look, I have been in insurance. Is the first real full time like career I had out of college. Right, I had other jobs, but I've been doing it. This is what I do. Like I'm insurance licensed. It's a big part of my day. And here's what I have noticed: insurance companies, life insurance companies in particular. I like dealing with life insurance companies because they're not as they're cheap, but they're not assholes like all the other ones, right? That's kind of the best way to describe that. But that's because everything is done on the front end. And John, like you said, they are the best risk assessors that we have in this country. The people that are assessing risk for a life insurance company are incredibly good at it. They make mistakes, yes, and they change certain products around and they get rid of certain products when they're not doing as great. But a lot of that is more accounting for changes in the economy and the market because again, they invest those premiums that they're receiving and they have to invest it into safer investments like treasury securities and stuff. So when interest rates are changed, the company's profits are changed and they adjust for that. But they are not going to lie to you. In fact, they're going to be brutally honest with you. When COVID started, they came out. I remember I think it was a long-term care case that was pending. And long-term care insurance is extremely difficult when it comes to underwriting because it's usually an older person. You got to be in great health. And I think it got approved. And when COVID started, they freaking kicked it out and said, we're not insuring anyone over the age of 65 for these kind of policies until we know more about the disease. Like they do stuff like that. Because they are going to take every precaution unless you got like crazy amount of money that they're willing to insure you for. Will they sit down and look at you and give you exceptions to certain things? But very, very rarely other than that. It's extremely discriminatory, and they're allowed to be because they're insuring you and giving you their money. Insurance is not a scam like everyone thinks. Insurance is a great thing, especially with life insurance. In fact, life insurance companies are more on your side as a private individual than the government's. Because what a lot of people don't know is that life insurance death benefits aren't taxable. So when you die, if you had $1 million life insurance policy, your beneficiary gets $1 million, they don't report that as income. Life insurance is the best way to transfer money after you die. That is. Articles I'm seeing on this are written back in January. I thought I saw a picture of something like Carlson. I tried to find a video of the guy coming out and talking about it. I didn't know if he was on his show or not. But
That's where I got the clip about it. Yeah.
was on Tucker Carlson?
Yes.
Okay. So did he say anything other than what we're talking about? What did he think? Was there anything else that kind of went into that
Well,
conversation?
it was a short clip that I actually found. So, but it was pretty much what we're saying. He was concerned about why and the reasons behind it. He did kind of allude to the jab. Um, but that was all that was in the part that I saw. If there was more to it, I didn't see it.
So he kind of played it as in it was the vaccine's fault. That the road he was trying to go down. Then T-Fish says to check out that link. I'll check that link out. I'll copy and paste that link and check it out when I'm done with the show. Look,
he sort of alluded to it.
I'm not gonna sit here. I don't talk about COVID all that much here, and the reason I don't is because you get COVID everywhere else. You hear about it everywhere. I'm not trying to drown my show with the one topic that honestly I'm tired of it. Like I'm tired of it. When I go on to other shows and they talk about COVID and the shutdowns, look, I know and it's so frustrating, and I know people are so pissed off about it because you're if you go listen to live shows on Podbean or Castbox or whatever, and that is a lot of times the main topic because not just here in America. In fact, I'd say we've had it great when it comes to these restrictions, as bad as that sounds. But some of these people are just getting crushed, like Canada and New Zealand and Australia just got crushed with regulation. And you feel bad. I feel bad for them because I know when I listen to the Aussies talk, when I listen to the New Zealanders talk, they're fucking mad. And you should be. There's no excuse. When you have Trudeau, like, you are a prime minister of your country. You're the highest power in Canada. And you have truckers willing to shut the damn economy down and come sit on your front door for a reason that is so obviously wrong. And your reaction is to make laws to ban them from honking horns and protesting? Come on. Like that's the I get it. Because I'm with them. I am with them. I'm with the truckers 100%. I'm with the people in New Zealand that are on Podbean, talking about how can they do something that's going to change them from being it's oppression. It is. And I just try not to drown people in it on my show. But when you see a statistic like this, that's scary. It's scary because, like I said, they're probably going to spin it and say that it was, COVID related. Hell, everyone has COVID, right? Like CTE. When I die, I guarantee you my autopsy is going to show them that I have CTE because of my football career. But does it affect my normal life? Am I committing murders? No. They wanted to blame Aaron Hernandez committing murder on CTE. They want to put who's the damn football player earlier this year on they want to look at that for CTE. They want to put Junior Seau's suicide on they want to blame it on CTE. But come to find out, you don't even know you have CTE. They don't know until you die and they autopsy your brain. How many soldiers have CTE from being blown up? How many soccer players have CTE from headbutting a ball all the time? How many hockey players have CTE? How many people have CTE from being in a car accident? Everyone has hit their head. And, it's just, they want to focus on stuff like that, and it's not a good excuse in my opinion. And now with COVID, now they're doing the same thing with COVID. And it's worse because with COVID, if you got COVID, they were financially compensating the hospitals or the doctor's offices for reporting it. It's like, hey, you want to be corrupt? Like they're asking for corruption doing that. They didn't, take a like the hospital didn't come to the government saying, hey, we're just fucking overwhelmed and we don't have beds and we don't have money. Can we get help? That's not what they did. The government just came out up front and said, hey, if you got a COVID death, we'll give you 30 grand or whatever it is. And if you have a COVID sickness, we'll give you 10 grand. Just throw money at it. That goes back to what I talked about yesterday with the modern monetary theory. Money just grows out of thin air with our government, so we might as well utilize that. Come on. It's irresponsible. And it takes away funds for the people that do actually need it. But if I'm a hospital, if I'm running a hospital, of course, how can we get more COVID patients in here? We're going to test everyone that dies. We're going to test everyone that comes in, whether they want to or not. We're going to say they can be asymptomatic, and it just skews everything. It throws the whole thing off balance. Because we don't know. We don't know if COVID is worse than what it's supposed to be. Because apparently, according to the new death rates, COVID sounds pretty bad, because you would imagine that that's a lot of the reason for the increase. Or we don't know if it's if it's not nearly as bad as what they say it is. I side more on the second part of that. I don't think it is as bad as what they say it is. I think it's just new. That's it. It's just you have the flu, you had the cold, and now you added COVID. There's not going to be any difference. I've had it. I know John said something earlier about he may have it. I don't think he has it, but at least not as of now, from what he knows.
He'll tell us in a minute.
Yep. And it's frustrating. I get it. It's frustrating. And this
I took the test. My wife got something from CVS, and I came back negative. I mean, I still have a sore throat and a little bit of a slight fever and a raging headache. So I don't know if it was a false negative.
You got it.
You think?
Yeah. Those are the exact symptoms I had. It took me a day and a half to 2 days to actually go and test positive. And it barely showed up when I did, but then I took another test 2 days later after that. And that's the same exact test you're taking, and it freaking showed up positive before it even finished up the the great thing goes up. Yeah. It took me a while to actually test positive, but and you're probably in the. I started kind of getting a fever. The headache was the worst part, but if you're up and moving around, it's not as bad. You actually will feel better. You just don't lay down for long when you feel like it. And then T Fish over on Castbox. Go ahead.
I said I'll take it again probably in a couple of days if I still feel raunchy.
Maybe tomorrow, the next day. I bet you test positive. Just seems like you got the same exact symptoms as me.
Thanks, Michael. Thanks for the encouragement,
I'm just
brother.
Being honest. And T Fish over there says they've never been tested. I never got tested until I tested positive not last week, but the week before. Says, I was listening to the radio, they had a professional on, and people were calling in because they weren't able to get the test. And one caller asked, he has COVID, but the test says he doesn't have it. And the professional said, just keep taking the test until it says positive. That's basically what I did. I didn't take more than one a day. I took one every day because my mom and my grandmother had both tested positive, so I figured I had it. And then when I really got the symptoms, I knew I had it at that point. It just, for whatever reason, wasn't showing up. My dad got a little bit of the symptoms. He didn't test positive until right at the end. And he really didn't get that sick. I got sick, way sicker than my dad did. Jester says, they told my mother-in-law something similar. Too many false positives. Yeah, the tests aren't perfect. Not even close. COVID so dangerous. You need to get tested for it. LOL. Great quote. Look, I know COVID is a touchy subject. I've heard many different theories and opinions. It has sparked a whole bunch of conspiracy theories, and some of these conspiracy theories have, come to fruition. So there's nothing that's too outside the box here. I will say this. The Beijing hosting the Winter Olympics is probably the most disrespectful thing to the entire world that I've ever seen. That should have been rescheduled a year or so. Like, when all this stuff went down and we found out it came from China, they need to just reschedule that thing and move it somewhere else. That's wrong. That or the revenue that they generate from
Cancel the
it
games
needs to be.
altogether.
Well, I don't want to cancel them because you understand, athletes work really hard for a long time to go to the Olympics. This is why I don't like the whole boycotting the Olympics deal with like countries boycotting it, because those athletes work their ass off to get there. And you may not agree with what someone want to do, but they work 4 years to get there, and some of them will never go again. It's not every year, right? It's not just a new season. It's every 4 years. It's a long time. And you don't want to punish them. But the revenue generated that or the revenue that Beijing generates from the Winter Olympics should 100% go towards a fund that compensates people impacted by COVID, in my opinion. They should not get any of it. This hard. Will the test being recalled? Why aren't the positive cases being recalled? Yeah, that's a good point. And here's the thing. I never reported my positive test. Ever. So how do they know how many people have taken tests? Oh, damn it, I'm positive, stayed home for 2 weeks, had some symptoms, and there's a lot of people that have had COVID that we don't even know about. Let's be honest, the COVID numbers are probably far greater than what they actually say as far as actual cases, which means that the death rates are probably far lower than what they're reporting. And we know they're far lower because not all the COVID deaths are actually COVID deaths. But, going back to what you said about why don't they recall those cases, well, it's probably because they know that there's a lot of people that take the test that don't report it. And, yeah, that's a good point, too. He says, or there's a lot that have it and we didn't, or that thought they had it, but they didn't. There's a lot that didn't have it and we thought they did. Here's my conclusion, though. My conclusion is that the CDC reports statistics that are in favor of the government agenda, and this is noticeable, and that favor the vaccine. If you notice, they don't report a lot of percentages in those statistics. They report whole numbers, and they compare it to, like, if you want to look at a demographic, they do it as a percentage of the entire population, but they don't do it as a percentage of that particular demographic. He said, it's fine, Michael. I can't read good either. I'm supposed to be an intellectual. But they don't report, like, okay, how many black people are unvaccinated. They only report how many black people are vaccinated compared to the entire population. That doesn't really tell you anything. In fact, it skews your opinion, because then you don't realize, okay, only half of the black population is actually vaccinated for reasons that are completely up to them. What's up, Don't Hasselhoff? But then that also starts going, when you look at those numbers, it goes against the agenda of denying the vaccine is a Republican problem, when it's not, because 90% of black people that voted for Joe Biden, and only half of them are vaccinated. It's not a Republican problem. It's not a Democrat problem. It's I don't want to get the fucking vaccine for my own fucking reasons problem. That's what it is. And they should have the right to do that. And you have these governments that are being oppressive. I'd like to see, John, other countries' data on the increase in deaths. I'd like to see where what that looks like. Are they seeing this 40% increase? It just, to me, it seems like there's just
Would you
something.
think, Michael, would you think that if that figure would be lower in other countries, that would be more apt to be the reason of, the vaccine itself? Because, America was probably first and foremost to be able to get as many people in their country vaccinated as other countries did.
Yeah, but some countries have a higher vaccination rate, I think, because they were actually able to like force it on people. Um, I don't know, because I could see this report also. And now that I think of it, I think I said this earlier on your show, John. If an insurance company wanted a reason to justify increasing premiums, they would come out with this statistic saying this number and talking about how it's costing the insurance company. Um, so you do have that thought. As honest as they normally are, there still is that thought in the back of my mind because they still are a business. And you want to increase premiums and you got to justify it. And that's a way to justify it. Look, we are taking on. It's not a good reason because that should already be accounted for, but it is a way to justify it. And I don't know if other countries and their leadership would try and have same kind of numbers showing people how deadly the virus is, and as a means to get them vaccinated. This kind of report can be used a lot of different ways, and it can be interpreted in a lot of different ways. It's going to take, I'm going to have to go and read more and look at some data and maybe crunch some numbers on it. I'm just kind of looking at the shell of the whole thing. But it's almost unbelievable. It really is almost unbelievable. Especially after Jester went and got the numbers from 1939 and 1944. I don't see how we can have one of the worst wars in human history where we fought a war on two fronts, and that year included the largest invasion ever in one of the deadliest days ever for the United States. Yet we had less people die than we did the year before the war, the year before we entered the war. It makes you wonder. On Castbox, it says in Canada, restaurants can only have 50% occupancy, but also you have to have a COVID passport. Why can't it be 100% if everyone that goes in has to be vaxxed? That's a good point. There's a lot of backwards shit when it comes to the COVID restrictions. There's a lot of restrictions. You look at it and you're just like, this makes no sense. Not one bit of sense. Think about it. You go into a restaurant, you have a mask on. And you have to wear that mask from the time you walk into the door to the time you sit down at your table. And then once you sit down, you can take it off and talk. Some restaurants crowded. That doesn't make sense to me. I've seen it. Think about getting on an airplane. When they started having full flights again, they still made you social distance, do their little 6 foot apart thing and had you, standing on stickers and stuff that measured distance out between you and someone else. You had to have a mask on. But then they're willing to sit you 3 seats across, with people filled the airplane up. It's like, so you got to have the mask on the entire plane ride. But when you eat, you can take it off. I guess COVID doesn't come out your mouth when you're stuffing it full of food. It's ridiculous. It's really ridiculous. It's crazy. And here's the other thing I was thinking about today on my way home. We have a society that is, all about inclusivity. I think that's the right word. They want to be inclusive. They want people to feel good about themselves. I had a whole show the other day that discussed some people that worry about offending people so much that they're willing to just hold it in, right? The whole white comfort conversation we had and all that. Like, we have people whose days are completely ruined because they don't want to make people feel bad. They want them to feel okay about themselves. But we want to force masks on children. So, what are you telling a child if you want them to feel good about themselves? When you go to them and you say, no, you're not allowed to show your face. And then you know, even in the beginning, when schools weren't open, I don't know if schools still aren't open in anywhere here in the United States. They've been open here in Tennessee for a while, but when they were shutting schools down and they were doing the online teaching, now, I mean, you're just teaching an already socially challenged generation to be less social. You're teaching kids to grow up and say it's okay to talk over Zoom. It's okay to cover your face. It's crazy. It's outright crazy. I don't have kids yet, but I would not want that. It's extremely important for kids to go to school and interact with other kids. That's how I feel like they would learn more. That's like where most of their learning comes from. Because if they're just home with you all day, they're just getting you, right? They're just getting your opinion. They're just listening to me talk shit all day, being conservative. They don't get to go hear all the people at school. They don't get to go talk to the other kids, right? They don't get to go play with the other kids. There's a lot that you know, there's a lot of problems presented in this thing, and they don't care. They don't. They just are the government, because it's public schools. It's not private schools doing this, but the government is so willing to just push this narrative that they've been pushing since COVID started. They haven't changed it. And the problem is that everything else has changed. I get it at the beginning. Okay, wear a mask. You know, we're trying to come out with the vaccine when we don't know a lot, like the first 2 months, right? But then as things move on and progress and we learn more, then we need to adjust. This goes back to what I said last night. I made the comment. I said, no temporary government program. Nothing is more permanent than a temporary government program. It's so true. When I read those words, my eyes just popped open. And it's that same concept that actually plays into things like this COVID deal. These temporary changes in our lives. This you know, wear a mask, socially distance, you know, just avoid social interaction, don't shake hands. Those temporary things that were put in place in the name of safety are now being pushed in certain states as the end all be all, like it's never going to go away. And it's just funny to me because when they say, hey, wear a mask and do this, you're doing it so we can not have these restrictions, right? So you want to restrict me so we don't fucking have restrictions. That makes sense. That makes a lot of sense.
That's what Trudeau said.
Yeah, I think that's where I got that from. I don't know. I saw something, I think, today. But what did he say?
You know, Mike, I think, well, he said that. I think what we're going to see, the damage that has been done as a result of the extremist types of mandates and different actions that we have put on everybody since, you know, the pandemic started, the damage of that is going to far exceed what the damage would have been from, you know, just letting it take its natural course. I know that sounds awful, but you know, what's to say 20 years from now, these kids, like I was reading a speech pathologist said that there's a 364% increase in speech communication delays in children who are masked, because that's how they learn how to speak and communicate, is by reading lips, basically. And we've masked them for a couple of years, and now they're seeing the same effects as like autism in these kids. So, the ramifications of the damage done is going to be huge.
Yeah. It's scary, and you hate to see it. You really do, because I don't know. Again, I don't try to go into this topic much. But here's what I will say. I'm going to go do the numbers, and if I don't write an article on it, I will definitely point it out on the show if I find something that's just crazy about it. And I'm almost positive I will. How can you not? A 40% increase in deaths. You couldn't try to do that. I mean, if you think about it, if we had a war in the United States, a civil war, you probably wouldn't even have that. One that didn't involve nuclear weapons, okay? I'm just saying a conventional war, you still probably wouldn't have that kind of increase. It just seems too unreal. I would like to, I guess, Jester, you sent me the 1939, the 1944 statistics. I would like to know what the 1860 and the 1863 statistics are. So 1863 is Gettysburg. 1860 is just before Civil War. I want to know the difference between that and see if there's a 40% increase in deaths there. That'd be interesting to look at as well. And if it's less than 40%, something's got to be wrong. There's 650,000 people, Americans, died in that war. All of them Americans. So something has to be wrong. It just seems, does it not? Like, when he says a 10% increase is like a once in a lifetime, or more than a once in a lifetime change. Buy it. I don't know if I buy it. And why isn't it? This has been out since January 7th. Why isn't it everywhere? Why isn't the number everywhere? Why isn't the government pushing that number to get people vaccinated? Because why wouldn't you, right? That would be the greatest thing for the government right there, is to publish that number in the name of trying to increase vaccinations. Because you're including a younger demographic. It's not just 80-year-olds. 1863 was 100 death toll, 130,000. What was the 1860? That's it. 130,000. I feel like there's 130,000 in 1863 in the war alone. That seems low. Well, hell, how many died at Gettysburg? 30? I mean, that's the height of the Civil War. So you look at the 1859 or the 1860 number, and we can get a good idea if there's a 40% increase. I imagine there would be, right? Have to be. There would have to be a 40%, at least a 40% increase in deaths from 1860 to 1863. And if there's not, I call bullshit on this number that they're presenting. Like, and then imagine, John, if that is accelerated, if that number keeps going. We keep having a 10% increase or a 5% increase. That's not sustainable. I think, didn't the population in the United States actually fall last year, not counting all the illegal people that came across the borders? When you subtract them out of the equation, I think we actually declined in population. Federation. So yeah, Gettysburg, 23,000 died so 51,000 people died at Gettysburg alone. You're saying 100 nasty number. And while we find that, yeah, we spent an hour discussing this topic, but it is an interesting stat. It is one I want to look into. And let's go back to Trudeau. And I normally don't like talking about other countries' leaders because honestly, I don't give a shit about what happens in the United States. Because it's been well known that these other countries do this stuff. And they can figure how long it takes to produce a vaccine. Look, I know it takes a long time, Sava, for sure. That's another argument I want to address. And I guess we're just going to take this show to talk about COVID. But the other problem I want to address is when people say you need to get the vaccine and why are you against getting the vaccine? You have to get the polio vaccine. They mandate that. Well, polio vaccine completely eliminates my chance of getting polio. I think there's been like one polio case in the United States since the vaccine has been around. Maybe a few more than that, but it's not here. And it took years to develop that vaccine. Other vaccines you get that they mandate completely eradicate whatever virus they're created to protect you from. The only one I know of that doesn't is the flu shot. Guess what? They don't mandate the fucking flu shot. You go get it every year, your choice. Why? Because it doesn't prevent you from getting the flu. It just helps out. This is along those same lines. So it says 384,153 deaths reported in 1859 to 1869. What's up, BP? Oh, 59 to 60. So again, another drop. So you're telling me less people die in wartime than they do in normal times, but we just had a 40% increase in the amount of deaths. That's weird. That's really weird. It says there's a smallpox outbreak not that long ago, and it was in the vaccinated population. Really? I didn't know that. And then Trudeau hides instead of addressing the problem, comes out of hiding, and gets mad that it's not over and done with. Strong leader. So the thing about Trudeau, it's funny because what is it? Trudeau was trying to ban the truckers from honking horns, which is kind of hypocritical because all Trudeau does is sit inside and honk his own horn for most of the day. So I don't see how he's able to do that. He's not doing anything else. It is kind of also, it's kind of ironic that he got COVID right when those truckers started showing up too. It just was it the day they got there, he somehow test positive for COVID, and I can't go outside and meet with these people. Yeah, man, vaccines aren't what they are claimed to be. No. I'm vaccinated. I got COVID. I just got over it. It doesn't keep you from getting the virus, and it doesn't keep you from spreading the virus because I got it from a vaccinated person. Now, Kid Commie is in the show here, and if you're a true communist, I would like for you to call in and would like to talk to you. Pick your brain on what has led your life to go down the road of being a communist. So, Kid Commie, you're more than welcome to call in. In fact, I would really appreciate it if you called in. They should be calling it COVID shot instead of COVID vaccine. What they basically call it. I'm the list guy, Mike. I didn't consider my name before I entered. So it's a joke you're saying. I got you. Go ahead, Eric.
um, well, the reason why, like when you get the flu shot, they don't call it a flu vaccine is because we know the flu shot doesn't cure the flu. But like a vaccine like polio, is meant to completely cure it to where you can never catch it. But maybe probably once every 10, 20 years, you'd probably need a booster to make sure it's updated. But if you're having to get a shot updated like every few months or few years, they should be calling it a shot. And like the pneumonia, for example, they call it pneumonia shot and not pneumonia vaccine, which is updated traditionally every 5 years. And and when we talked about the polio vaccine a while ago, it took 50 years for it to be developed.
Yeah.
And the one doctor who developed that, the most noble thing he ever done was he never patented his work, and he was questioned about why did you not patent your work? And his answer was simply put, this belongs to humanity.
No, it and a lot of this also goes back to the Joe Rogan stuff, right? We talk about we all know what's going on with Joe Rogan, but he has people on a show that come from all different walks of life, all different opinions, but some of them are actually the most knowledgeable, and they're known to be the most knowledgeable people in their industry. Like he's not just having some rando on the show. I mean, we're talking about Elon Musk, people like that are well known as either a genius or as a industry leader, or like these are like the best of the best people he's bringing in because he likes learning from these people. And you get shows like CNN and The View and all them that are uh, criticizing Joe Rogan, saying that I should not listen to him because he's a comedian. Well, haha, CNN, the fucking joke's on you. Because you don't have near the quality of people on your show to draw me over there and want to listen to them. Who does CNN have on their show? Well, they have their little medical doctor, the same guy that Joe Rogan had on their show, on his show. Remember that? It's not like Joe Rogan's shutting people out. He's not. He's not creating a narrative. You watch a show, all he does is ask questions. He throws his opinion in there sometimes, especially in a case where he actually knows what he's talking about, like the MMA or something along the lines of exercise or whatever. Politically, very rarely does he actually state an opinion. The only opinions I've really ever heard from him politically was just him saying he didn't like someone like Clinton. He hates Clinton and he hates Joe Biden. That's it. Steve Fish says CNN ratings are down 90%. They are. And if they didn't have the airport contract, I'd probably have more viewership than CNN. That's how I justify pushing through these days of doing this podcast. Just knowing that my 1 or 2 live viewers on Facebook is more than CNN would have if they didn't have the airport contract. So, with that said, it's just crazy that. And then you have people that are wanting to pull music off of Spotify unless they get rid of Joe Rogan. Well, good luck with that. Then they can't do that, so they go back and they try to hit Joe Rogan on saying the N-word. Now, I actually have been listening to Joe Rogan for a while, and I've heard him say it on a show. And I have thought, I'm surprised no one's actually said anything about him saying it. He doesn't use it a lot. He has only said it, like it. And what's funny is the majority of the time when he says it, he's talking to a black guy. I'm not making this up. And if it was such a problem, why didn't they say it then? If Joe Rogan was such a problem, why didn't everyone else? He has 11 million viewers. I'm sure some of them work at these large media places like CNN, who doesn't like Joe Rogan. Why didn't they call him out on it then? And just to clarify my view, I went off the other day about Whoopi Goldberg's suspension. I said she should not have ever been suspended for what she said, especially because they pay her to do that. They pay her to state her opinion, as stupid as it may be. Just like Joe Rogan should not have any kind of punishment or have to apologize for anything that he says. And I know he has been. There's controversy around that. But he shouldn't have to apologize, and there shouldn't be any fallout as far as from Spotify about his past episodes, especially since these episodes are like 2, 3 years, 4 years ago. These aren't recent. And even if it was, let the viewers take care of that. If people don't want to listen to him, they won't listen to him. If he says something that's out of hand, they'll probably not listen to him. We've gone on about this, and people need to realize this isn't North Korea, where you have one channel, and on your one channel you watch Kim Jong-un and his dad and his grandfather pick up a machine gun and single-handedly, as a trio, kill 1 million Americans at the chosen reservoir, and then jump in an airplane and go bomb U.S. destroyers, and then put the one destroyer that they sank on display at a museum in their country. This isn't North Korea. This is the United States, where you can go get a package at Comcast or AT&T for 25,000 fucking channels. And when Joe Rogan says something you don't like, get out of the Spotify app and go watch TV. Or go on YouTube and type in Rachel Maddow. Go listen to her. Go listen to someone else. Hell, it doesn't matter. There's a plethora of people. If you don't want to listen to me, go listen to John Gale. He's another conservative. There are millions of people doing this. It's not like you're limited here. So don't call to get someone canceled. Just don't listen to them. Just avoid it. It's like walking away from a fight, right? You don't want to get in a fight, just walk away. Sava says don't listen to Rachel Maddow. Look, Sava, I'm just throwing out names here. Go ahead, Eric.
Well, and I also liked where Donald Trump came out today, urging Joe Rogan to stop apologizing, and I think that is also a great point right there. You know, and I've even mentioned this previously on that the thing about, you know, apologizing like he's doing, you know, whether it was, you know, I think really what the thing is the more you apologize for something, whether you did anything wrong or not, is the more, when you apologize, you're basically giving this woke cancel culture mob a win.
Mm-hmm.
And you should never apologize for being you. And it's like here on this podcast and other podcasts we have here on Podbean, the reason why we take a very unapologetically unfiltered approach in the things that we say and do is because being unapologetically unfiltered, you're going to say what you mean and mean what you say. Whether you like the things we say or not, we can give two shits what you think.
And it's not even, it's a lot of it is people need to be able to vent. Like, you know, you put on the Podbean, a lot of people, I think, get on Podbean because they can go on the live shows and they can express themselves. And they can do it in a setting where it's
therapy.
It's controlled, it's their show, and it's like a therapy. And you see a lot of people from other countries on here doing that. Because they don't get to do that in society. The problem is, I'm not saying to go out and just start motherfucking people out in the open, you know, on the sidewalk. No, absolutely not. Be respectful. But when you state an opinion, and it's something as small as, I don't want to get vaccinated. I don't feel comfortable with getting vaccinated. And they just completely create a narrative about how you're the problem. That's not fair, and that's not right. And it's not true. It's the other night, I called Michael J. Steele out about this at the end of his show, about Biden's pandemic numbers. Not pandemic numbers, but economic numbers. And the pandemic played into this. And we were talking about how unemployment is almost as low as it was, right? It was right back to where it was pre-COVID, like 3.8, 3.9%. And while we're talking about this, Michael J. Steele keeps going on saying how we are bringing in doctors from foreign countries to work in our hospitals. And I asked him, I said, why are we bringing in foreign doctors? Why do we need foreign doctors? We have so many doctors here. Well, they can't, I don't even know what crazy reason he had. And I said, so you're telling me that Joe Biden actually put in policies that have disincentivized people to go work, which means that his economic data regarding Americans is wrong. They're lying about it. And I think he's went on about something with the pandemic. I said, okay, so is it the pandemic or is it what? He's lying about something. Because he's either lied about how he was going to handle COVID and shut it down. Well, that wasn't true because he's had the vaccine the entire time he's been in office, and deaths are rising. In fact, like this whole show has said, we're up 40% in the working age demographic as far as deaths are concerned. The Civil War and World War II didn't have that kind of increase from the basic numbers that we've gotten from the audience tonight. And we are bringing in foreign labor. If we have to get foreign doctors because doctors don't want to work, then you have really screwed up when it comes to incentives for unemployment, because that's a lot of schooling and a lot of money that they're trading off. We're getting lied to somewhere. We're either getting lied to about the unemployment numbers, we're getting lied to about the job numbers, we're getting lied to about the pandemic numbers, and what's causing the pandemic numbers. There's a big lie going on, and they know that it takes a lot more than just looking over the little amounts of raw data that they present on the CDC website for anyone to really draw a conclusion. But now you have these insurance companies coming out, and either they're lying or they're presenting us with a story that we don't actually get to see. And I'm curious, I'm curious to see where this ends up going. But go ahead, Eric.
I think a question at the end of the day we should be asking is, do you want to be a part of the problem or do you want to be a part of the solution? And I think the consensus is, Michael and John and friends down the chat like BP and Mr. T and Sava and Jester, is we want to be a part of the solution.
Yeah. So funny, or Friday kind of guy on Castbox says, funny that the company Neil Young that owns Neil Young's music moved Young's music and Spotify stocks went down. Do you think an 80-year-old man is tweeting stuff, or do you think it's a play by one music company to fuck another music company? Not for social justice, but for money. Look, I don't think Spotify's stock fell because of Neil Young or Joe Rogan. Now, Joe Rogan pulled his podcast on the platforms. Spotify stock will come crushing down. But Spotify stock did not drop because Neil Young pulled music or any other old person pulled music, because, like I've said before, if you're listening to Neil Young regularly, you probably don't know what the hell a Spotify is. And it wouldn't make that big of a difference, especially because when you go on Spotify and you go to type in an artist you want to... okay. Someone says, I listen to Neil Young. But when you, my next argument to that is when you go on Spotify, God dang it, John. Spotify, someone typed in spot a fly in the chat and I read it and that's how I pronounced it. When you go on Spotify.
Jinsaki, a.k.a. Hacky Sack, a.k.a. Peppermint Patty, a.k.a. Ratchety Raggedy Ann, created a meme right there in calling Spotify Spotify, FYI.
But look, all the tech company stocks fell. All of them. A lot of them over 50%. There's other reasons why Spotify's stock fell that are far more influential than Neil Young pulling music off of the platform. Because what I was going to say in T-Fish, you said you listen to Neil Young, but you also probably listen to a playlist. Because when you type in, okay, I want to go, unless you're paying for Spotify, which is good for them, they're getting revenue from the premium that you're paying. So, someone pulling music off probably wouldn't. But unless you're paying for it, when you type in, Neil Young, you're going to get one of his songs and you're going to get a playlist of other music that's just like it. So, like you said, you pay and you make your own playlist. So you haven't given up that subscription yet when Neil Young left. And I guarantee you Neil Young wasn't the reason why you went and paid that premium. Think about it. I mean, I love country music. Now, if they pulled George Strait off of Spotify and I was paying for it, then I probably would not pay anymore. It's like my favorite singer. But if you pulled some other smaller artist off, I probably wouldn't think anything of it. That's not the reason Spotify fell in value. A lot of cost. Now Facebook. Now they fell in value because I believe that that is a lot of that is self-harm with Facebook. For those of you that don't know, Mark Zuckerberg lost close to $300 billion. Facebook lost $300 billion. I think Mark Zuckerberg lost around 50 or 60. He lost a lot of money. A lot of money. Could you imagine? And look, people are going to look at this like, well, he's got so much money, he's got $100 billion. What's it matter if he loses 60? Could you imagine looking at your account and you were down $60 billion in a day? Like, that's just crazy. Well, we're going to try this now. We have, so I can't really see it on Castbox there. What's going on?
Hey, how you doing tonight?
Good. How are you? Can give me one second.
Let me just say.
1 second.
I'm sorry?
Give me 1 second because you're actually going to help me out with something. You're the first caller on Castbox. Can you guys on Podbean hear him?
Okay.
Yes, I can.
Yep.
Awesome. Perfect. All right, go ahead. Go ahead with what you were saying.
Well, let me just first of all say Mark Zuckerberg's a liberal son of a bitch, okay?
I agree.
$50 billion to a liberal. Liberals, they just handing out money like hand jobs and a goddamn monkey orangutan do, shit.
They are. I agree. That's funny. That's funny. I'm glad you just called in and said that.
Well, thank you for taking my call. I appreciate it.
No. They're laughing over on Podbean too at what you said. You're right.
Well, anytime you get to laugh at a liberal's expense, I'm all for it, okay?
I get it. Raccoon, are you gonna say something?
I was just going to say that was classic.
That was classic.
Well,
What
I
he
appreciate
said was
that.
classic.
Shit.
That's a good way to look at it. Look, because I work in that industry, all right, and I know how it works. He can recover in
what industry?
I
You
work
run
in
a zoo?
finance. No, stop. Oh,
Sorry, continue.
No,
My
this
bad,
is
my bad. Just had me
hilarious. I love this. I can't even talk. No, I work in finance.
Okay.
Now
Bernie Madoff, he did that too, I think, didn't he?
Yeah.
Excuse me, guys.
It's all right. I keep interrupting you. I apologize. They don't let me call into these programs very often.
I love this.
I'm down here in Baldwin County, Arkansas, and I'll just let you have the floor, sir. I appreciate you. Take my call, though.
You are good. We're over here in Tennessee. We're not too far. That is
Hey,
hilarious.
hell yeah! It's a good state. Good state.
Yep. It is. Arkansas is a good state too.
Hey,
Not
Mike.
a lot of people, but it's a good state.
Hey, Mike,
I heard
can I
that's
ask
where
that guy a
Elvis
question?
Presley.
Yeah.
I've been to. Oh, sorry. Go ahead. My bad.
Go ahead, Rickon. Ask him.
Yeah, guy question. In Arkansas, what do they call a family reunion?
there's a couple different slang terms for it. One is the dirty Sanchez. There's another one called the sin squashers. Sin squash or something. I got a couple of third cousins. I never married none of them. I had a brother-in-law who married
I'm just messing. That is funny though.
Yeah, they call family reunion in Arkansas an orgy.
Oh God.
Orgy. You know what? I'll tell you what, it's pretty good. It's pretty accurate too. Franklin County, the county over next to here, legal, absolutely legal to have them orgies.
Really?
Hell, I don't know. It sounds like Franklin County's ran by goddamn liberals. It wouldn't surprise me.
Everything's legal if you don't get caught.
Also, if the liberals allow it, okay, that's all I'm just saying.
He said, make sure you take Spirit Airlines to Michael Key. Hilarious. So I'm glad I got this figured out where we have Podbean and Castbox can to each other. I'm sure if Podbean or Castbox finds out what I'm doing, they will probably shut me down very quick. But oh well.
Well, you ain't worried about that. I got a cousin-in-law who's a comptroller over there in Nestle County, and if he can put in a good work.
Say that again. You cut off at the end.
For you, it's possible to merge two applications in such a way that this into the nexus of the universe at the corner of First and First. Well, I don't even know what I was saying. Something about Bill Clinton this and nexus of the universe that First and Fourth.
How are you gonna talk shit about Bill Clinton?
I think about 15
He's a
years
former.
I was up there in New York.
Good. You're like cutting in and out, so it's hard.
Listen, hey, this is former President Bill Clinton. I apologize. If you're going to talk about me, let's talk about reform. Let's talk about Republicans and what they're trying to do to all the hammocks in this country. I'm gonna get you a brand new hammock. They don't want you to have that hammock.
Dude, that is good. You're a comedian or something, aren't you? You must be a professional doing this if you're calling and making these kind of jokes and then doing the impersonations.
I just have fun with it. So yeah. Well, that's the George Herbert Walker Bush.
Wait.
Barbara, yeah.
So the accent wasn't even real.
No, that's just a character.
That's good. When you first called up, I'm like, okay, that's good. That's very good.
Job of making people think that I'm a stupid hillbilly son of a bitch. Okay. Hey, now, am I one? Maybe.
Me too. So be careful now.
I know, right? Well, I'm from Kansas, so I can say that. I'm born and bred Kansas hillbilly.
There you go. Except there's no hills.
Well, if the governor has her way, there will be.
Oh, you got one thing over the other politicians around your area. You did sleep at a Holiday Inn Express one time. I can tell.
Well, thank you. It's actually how I saved 15% on car insurance. It was in the lobby of that Holiday Inn Express. I was on Geico.com. It's a double whammy.
I'd prefer like Progressive for Flow, or I would prefer State Farm for the old lady who says 6 cars ahead of us, Jimmy.
You just want to do a commercial with her.
All I heard was Progressive, and it scared the shit out of me. Okay? That's all I heard was Progressive. And scared
the name screws itself.
I digress.
But then again, owns Progressive.
Why wouldn't you want to go with Progressive? Because they're paying money out like it's no one's business. Like why wouldn't you want to?
I'm maybe having to rethink my car insurance.
What's that record?
Mike, this guy needs to be invited back on so we can have a real knee slapping day.
So I don't know. Look, is it Quantavious D is his name?
Yes, Quantavious D.
PhD.
Well, yeah. My name's Drew.
Drew, okay.
Yeah, I have a couple of podcasts. Like I have a podcast on conspiracies and cover-ups and ancient knowledge and suppressed knowledge and the esoteric, the occult, numerology.
Could you do me? A lot of audience over here on Podbean loves that kind of stuff. And
oh my god, so fucking sweet. Oh my god, yeah, totally. Yeah, I will do that.
Now you're cultural. Yeah, you're doing cultural appropriation. Come on now. Drop your shows in the chat here. I'm gonna send them over here to Podbean so they can check that out, because the Podbean audience is all about the conspiracies, and they also seem to be favoring your humor because we're getting a lot of people in the chat that are just laughing at it, and I think you're great. So go ahead and do that. World order, okay. Paste it over here. All right, so on Podbean, Quantavious D is his name. Drew is also his name, but World Order looks to be the name of the podcast. Go check him out. Can you guys not hear me on Podbean? Oops, said what happened. I think I
can hear you.
I'm still here.
Okay, good. Does anyone else have any other comments, anything they want to bring up? We have about 15 minutes left on Podbean as far as what I'm allowed to do. I'm probably going to cut the Facebook feed here soon. I've kind of discussed everything I wanted to discuss. People on CastBox as well, stay around. And, you know, anyone else that wants to call in, got any jokes, got anything stupid to say, we're all for it. I love laughing at it. But does anyone else have anything to say?
Well, I was going to say something till that guy got on there, and I lost my train of thought.
Well, I went on about how you know how much it sucks that Mark Zuckerberg lost $60 billion. All of a sudden, he comes on there and makes his jokes, and now I don't feel very fucking bad for him anymore. It just completely changed my whole mentality on trying to justify us not being okay with him losing that kind of money. But who cares?
I will say this, Michael, that all them people in the heads all need to have money lost like crazy because they've been basically getting a bumper crop of money coming in since they started this whole damn lockdown bullshit and the COVID extravaganza.
Well, it's not lost. Here's the thing. It can come back. If he runs the business properly, here's the thing. All Mark Zuckerberg has to do is stop being such an asshole.
Hopefully it fails, though. Hopefully the company fails, what I'm saying.
Yeah.
If they just got to the point where he can't use it no more, he'll quit because he won't see any profit anymore, won't be the richest man in the world anymore, which he ain't now anyway. But his feelings will get hurt and he'll fall like the rest of them and go off to the side somewhere and pout for a while and try to figure out another alternative to making illicit money.
And Quantavious D, I don't know. It looks like he fell out of the chat here, but I do appreciate. Just want to do a shout out. That was funny as hell. You call in, feel free to call in at any time. But that's you make a good point. And so someone says if Facebook falls, then other big companies become bigger. Well, maybe they could. Yes, the idea is that another company that is competitive will come right up in its place, right? So there's a lot of things that could happen. I'm not saying Facebook falling would be good or bad. It would hurt for a while. It hurt a lot of people because that's a huge market cap that's coming down and going out of business. It could be substantial. They do have a big economic impact. So you don't want to see them just fail, at least not immediately fail. But it is funny though because there's a really simple fix. Honestly, there is a simple fix for Mark Zuckerberg. Don't be so invasive with people's privacy, and don't be such an asshole that you're censoring everyone. And if you're gonna censor people, censor both sides. Now, Power J, you called in. Did you have something you wanted to say?
Yeah, I did. I heard earlier that you're an insurance expert, and I happen to get a thing in the mail today, so I hope you don't mind me asking.
Yeah, go ahead.
If I have a bank account and they're offering that says immediate reply requested, and they're giving me $1,000 of accidental death and dismemberment insurance. So they're giving me that for free, and then they're trying to upsell me on more. Now, if I understand accidental death and dismemberment insurance accurately, if I die of a heart attack or I get a tumor on my brain,
It wouldn't pay out.
yeah. So it's like, why would anybody want to have that? I mean, I'd have to like get my arm stuck in a combine or get, hit by a truck crossing the road
Yeah.
for
So
this to pay out.
when you think about insurance, as far as how I've always kind of broke it down and looked at it is you have two ways you can die, either an accident or an illness, right? Now, obviously, there's so many different variables and categories inside of each one of those, how many accidents and how many illnesses, right? But eventually, that's what it comes down to. So some people aren't healthy enough or they can't get fully underwritten insurance, life insurance, so that kind of disqualifies them from the health part of it or the illness payout of it. So some people will just go get the accidental. And at least that way, if you die that way, you have death benefit. Now, do you already have a policy and it's the same insurance company that's now sending you the letter saying, hey, we're going to add this on for free and then trying to upsell you on that? Or
No, this is a like a cold offer from the bank that I bank at.
okay.
So somehow the insurance company, I guess, has a deal with the bank that, hey, look, we'll give all your customers $1,000 coverage. Which what's that going to get you, really? So they're. I mean, it's why do I even waste the time responding to this thing? Okay, great. I have $1,000. So if I get a tumor, my wife gets nothing. But if I jump in front of a truck before the tumor kills me, then she gets $1,000.
Yeah, well, if you jump in front of the truck too, they probably wouldn't pay. It's got to be like a legit accident. And accidental death can be stricter because again, they're not underwriting anything, so they're not doing any like upfront research on you. So they're gonna be and what I usually say is when it's like that, then there's gonna be more. There's gonna be some stuff on the back end if something does happen that they're then going to look into it. It's either they're going to research now or research later.
So I'd have to fall in front of the truck. I couldn't jump in front of it.
Yes, it would need to be an accident. What I would do is I would go through it and just if they're going to give it to you for free, then why not? Right? What the hell does it matter? But that's not how it's going to be. It's going to be. It's probably, I would imagine, hey, here's $1,000 for free, but you have to go ahead with the upsell. And they're at that point just discounting it. Maybe I'm wrong. I just don't see how they would hand it out for free, no matter what kind of deal they have with the bank.
Members of the automatically qualify for this policy that's completely paid for by the credit union and issued by such and such life insurance company. So in the event of a covered accident, this policy pays a cash benefit to your family at a critical time. It's money your loved ones could use for monthly bills, or it's okay. So yeah, it looks like it's legit. I mean, they're giving you $1,000 coverage, but it just what are the chances of somebody dying from an accident versus natural, like a illness?
Well, so as far as where accidents rank on the like leading causes of death, I think it's like third or fourth on the list of the top 5. But you still have to take into consideration everyone's different, right? Some people do much riskier activities or a much riskier job, but anything can happen. What I would do, I think where I would start if I were you is it could be a deal that they have with the credit union. I'd call them and say, hey, I got this in the mail. Is that just something that because I have an account and a good standing with you guys that I'm offered and it's free? If it's free, it doesn't matter. Just take it. And if something does happen, you get $1,000 if it qualifies. As far as what, but if you're going to go pay money, then that's when you need to look into it. Or it's going to be some kind of restriction or there's something to it that's not necessarily beneficial, then you need to look into it. It should have all the, a list of everything that it'll pay out for. Okay, and I would keep that. Yeah. And it'll tell you on there what it'll pay out for. And some of it you're going to read and you're going to be like, well, that's stupid. But you do have to remember that it's $1,000 that they're offering you for free. So,
right.
If it's not going to make a difference in your everyday life, then so be it. If it's a perk of, doing business with that bank, then it could very well be a means to, try and gain customer loyalty at the credit union.
Yeah, it's interesting the exclusions. If it's like intentionally self-inflicted, so that would be jumping in front of the truck. Suicide or attempted suicide while sane or insane, being intoxicated, or as a consequence of taking or using a narcotic. So if I fall off a ladder and I'm under the influence, then that doesn't pay out. Unless it's under the administration of a physician. So if a doctor prescribes me a narcotic and then I fall off a ladder, I think it will pay me, but if I take it illegally, it won't. Mental illness or chemical dependency, declared or undeclared war. So if I die in an accident and there's like a skirmish, regular or irregular military force, it won't pay out. Insurrection, it will not pay out.
It probably has that one
So,
highlighted.
oh man, that's bad. So if like I was in Washington D.C. and I fell off the Capitol steps or something, it wouldn't pay because they would consider that an insurrection, I guess.
He's over here saying, "Fuck, my weekend plans are ruined now."
Yeah, the rebellion or revolution, that's out too. Use of weapons of mass destruction, including but not limited to nuclear, biological, or chemical weapons. Flying as a pilot or crew member. So if I'm a stewardess on an airplane and it crashes, it doesn't pay out.
Yep. And some will even go as far as if you were on the plane as a passenger, I think. Like, there's certain things, yeah, it can be restrictive with some of those. I would just, look, you keep that paper, okay? I'd verify with your credit union that it's free and that this is something that is actually being offered. And, yeah, keep that list there. So it wouldn't be you. You wouldn't care at that point if something happened, but your wife will. Right. Or your beneficiaries will, right? That's what I always tell people is like, it's funny when you're in it. I never realized until you work in life insurance, you spend most of your day talking about death.
Sure.
No, I'm serious. Like it's a wild thing, and you learn and it sucks because look, but you learn to discuss sensitive topics and be humorous about it. And I don't mean humorous as in like I'm not taking it serious, but I have sat down and I've had discussions with. I had one lady. She was trying to get insured, and she had some issues, like some illnesses and stuff. She was enjoying herself, and the reason why she was trying to get this policy is she wanted to have a grand funeral for herself. Like, honestly, we sat down. She had this plan. She knew, obviously, she wasn't going to fucking see it. But she had, a thought on how she wanted to go. And we sat there and talked about all the stuff she wanted to do. I've had that conversation. I've had, you spend so much time focused on death. And it can be exhausting sometimes. But it also gives you different perspectives on things. It does. And I've had 2 clients die since I've been doing this, and I've only been doing it for 6-7 years. And it sucks. It really does suck. But the one thing you always do know is that when a client does die, you're the only one showing up in their life to hand them a check. And sometimes it's a check for a substantial amount. So
there is a hallelujah moment there when that check arrives.
A lot of times you're the only thing that is bringing some kind of not happiness, but what's the word I'm thinking of? Kind of like resolve, like
relief.
Yeah, relief to them, because if
Aid.
it's done right, yeah. Because that's something they need to. People need to, when someone dies, they need to heal. They need to, worry about that and not all the other stuff. So it is a good, insurance is something that a lot of people have a lot of different opinions on. But it when it comes down to it, it does a lot of good. And there's certain insurances I think are a waste, but for the most part, it's. But you do learn working in the industry that the human life has a value, and not everyone is valued the same. Not even close. If you are looking for equality, then don't go to the life insurance industry, because you will find out that it is about money, and it is all about money, and that's it. They deal with people dying every day. You know, it's nothing new.
Yeah.
Like, you are another number to them. So,
Hey, just stumbled across your show tonight, and glad I found you. Thanks. A nice time. So
thank you for
take it
listening.
easy.
We are usually on about this time every night, so we're gonna go ahead and cut it. I got 1 minute left. I'm sure there's a show on after this. I'm running close to the 2 hours, so thank you to you guys on Castbox. Thank you to you guys on Podbean and Facebook. And we will probably be back on tomorrow.